Welcome back to the Michigan Business Beat, brought to you on the Michigan Business Network. Chris Holman here, and we're in our studios at the Capital Region International Airport. And we're going to go across town. Brian Peters, CEO of MHA, the Michigan Health and Hospital Association, joins us today. As always, welcome and happy holidays, Brian.
Thank you, Chris. Same to you, and always a pleasure.
Listen, all the advocacy work you do, can you recap in any way the 2023 legislative sessions and what important things came out, particularly related to healthcare?
Well, absolutely. It was a very productive year here in Lansing. We advocated, of course, for Medicaid funding that's so critically needed by our hospitals and health systems across the state to care for a population that is in real need of access to healthcare services across the board. And so we were successful in securing that funding and the legislative arena. The governor was certainly very supportive. And then, of course, behavioral health continues to be a crisis in Michigan, and we were very pleased to secure $50 million in new funding specifically to help build pediatric behavioral health capacity here in Michigan. And MHA was very pleased to be able to serve in a fiduciary capacity and disseminating that funding across the state where it was most needed. And so that's a building block, I would say, for the future. We were also very pleased that the work on one of our main priorities, workforce, continued. Earlier in the year, we were able to secure funding for our frontline caregivers for the recruitment and retention of nurses and others who we need so badly in order to provide care to all of our communities. And so I would say it was a very productive year, and we look forward to 2024.
Brian, tell me, why should the average business owner care that the protections found in the Affordable Care Act are now law here in Michigan?
Well, it's very important because all of our employers, large and small, we depend on a healthy workforce. And there are so many people here who have secured healthcare coverage through the Affordable Care Act exchange process. Many folks were added to the Medicaid expansion rolls in addition throughout the pandemic. And in both of those cases, what we benefited from was continued access to care. And you think about the preventive services that those folks were able to access where they might not otherwise have done so had they not had that health insurance coverage. And what that translates to in the long term, of course, is higher healthcare expenses for Michigan employers if you don't identify problems at an early stage, if you don't have those early interventions. And so at the end of the day, these new developments in the public policy arena really help to create some stability here in the state of Michigan for our workers, and really creating a healthier workforce long term.
Brian, why was it so important for the governor to sign these increased penalties for acts of violence committed against healthcare workers?
Well, this has been one of our longtime priorities, and it was really great to have Governor Whitmer right here at Sparrow Hospital locally for the bill signing ceremony. And in fact, we know that one of the main drivers of the departure of nurses and other frontline caregivers from hospitals and the healthcare field in general is this increase in the rise of physical and verbal abuse that they have experienced on the job. We think it's completely inappropriate. We think that if a flight attendant on a commercial airline flight is assaulted in any way, that's a federal offense, as you know. We've never had those same protections for our healthcare workers. And while this bill doesn't quite go that far, it's a step in the right direction, and it sends a very clear signal to Michiganders when you come to a hospital and you receive care and people are trying their best to deliver high quality, affordable care. Please show some grace, show some understanding. It's inappropriate to confront them physically or verbally in that manner.
Well, and we need people in that field, so that really is another important thing. So what ended up happening this year with that proposed bill mandating nurse to patient ratios in the hospitals?
Well, Chris, as you and I have spoken about previously, the MHA is very much opposed to this legislative proposal. that would create minimum nurse to patient staffing ratios in Michigan hospitals. While that idea sounds perfectly reasonable on the surface, the reality is when you do the analysis, it is wholly unworkable and unfair, and it will not solve the underlying nursing shortage that exists in Michigan and across the country. And thankfully, while there was a committee hearing in the House just before the break, there was no vote taken. And so we head into 2024 with an uncertain time frame for action in terms of future hearings or votes. But we certainly would ask all lawmakers, including the governor, to think long and hard before advancing anything of this nature. We think there are many other ways we can address the nursing shortage. This is not the right answer.
So, Brian, we got about a half a minute left. As always happens, we run out of time with something we want to know. What do you see in 2024? And I think you just spoke to one of the issues.
Well, certainly anytime there's a presidential election year, I think that changes the political dynamics in every state to some degree. Here in Michigan, depending on the outcome of the election, we could be heading into a wild and crazy lame duck session at the end of 2024, where some of the issues that you tend to think are bottled up may all of a sudden get some traction. That concerns us, obviously. But then again, depending on how the election plays out, lame duck could be relatively quiet. So, we're in the same boat with many other organizations as we look to that future. But I will tell you, healthcare remains one of the most complex and certainly one of the very most important public policy issues for our state. We're going to be there front and center no matter what.
Well, we'll hear about that all next year because we're going to bother you to keep us updated on that. Brian Peters, CEO of the MHA, the Michigan Health and Hospital Association. Top of the season to you, my friend. Have a very good holiday, and thanks for everything you've done for the Michigan Business Network in 2023.
Chris, happy holidays to you and your family, and we look forward to continued partnership in 2024.
Thank you. Thank you. You've been watching the Michigan Business Beat on the Michigan Business Network. I'm Chris Holman.